New from the News for Jack's I-Team, electrotherapies. Local patients struggling with conditions like depression, ADHD are finding relief with electricity.
I-Team investigator Ann Maxwell has been looking into these little-known, non-invasive treatments. Ann?
Yeah, Tarek, Janice, when you hear electric current, you might think electroconvulsive therapy, but research shows less intense ways to deliver electric currents to the brain can have real benefits for conditions ranging from anxiety to OCD and even schizophrenia and traumatic brain injuries. While more research is being done, local patients and providers tell us the results they've seen are nothing short of life-changing.
Welcome back. Good morning.
Thank you.
This patient turned to nurse Nicole Parker for microcurrent neurofeedback therapy in 2019. She was at a low point, straining under the pressures of a move, homeschooling her 4 children, and relationship issues.
My body basically was so stressed out that it was breaking down. It couldn't handle anymore. My brain was operating in a fight or flight state constantly.
Desperate, she turned to microcurrent neurofeedback therapy with nurse Nicole Parker.
I feel like melting.
Parker attaches electrodes to clients' scalps.
Let me know if you notice anything, if you feel anything.
They're connected to software that monitors and analyzes the brain waves. Parker is looking for areas where electrical activity carrying messages are overactive or underactive.
And we see a little elevation here, which I knew we would because of the stress.
The electrodes also deliver the therapy.
It sends little bursts of electricity that are about 5 billionths the power of one AA battery to those areas of dysregulation in order to balance the brain waves and gently nudge them into their pre-programmed frequency ranges.
Parker hooked me up to the system for a demonstration.
But you see with each exposure how that top red line will come down.
So I'm getting those jolts now.
Yes.
I can't feel it at all.
You shouldn't.
As for side effects,
The most common ones would be a headache, irritability, feeling wired or extremely tired.
she says they typically pass within 24 hours. The piece of equipment Parker uses has been classified by the FDA for 25 years as a relaxation device. The agency identifies risks as temporary injury or impairment and/or ineffective stimulation. Research on the benefits of microcurrent neurofeedback therapy is limited but promising. In a small 2017 study, veterans with mild traumatic brain injuries who underwent the therapy saw their symptoms reduced by an average of about 53%. This patient we spoke with says it's helped her too.
I was able to have a lot more clarity in my mind, and I felt more calm, happy, joyful.
She says it's allowed her to work through her trauma in ways other treatment hasn't.
Talk therapy, I think, is helpful, but neurofeedback therapy helped me in a way that talking never did. It's like it healed my brain from the inside without me having to speak about it.
Parker says typically after 10 to 20 sessions, the brain learns how to regulate itself.
And generally, my clients come to me after they have exhausted all other avenues of treatment and nothing else has worked. Or they don't want to go on to a medication. For example, with children, the parents often don't want to put their children on Adderall.
UF Health is using stronger frequencies to power treatment for patients. That's the sound of electricity, creating an alternating magnetic field that can heal. Since 2021, UF Health psychiatrist Dr. Daniel Lewis has been treating depressed patients using transcranial magnetic stimulation, also known as TMS. The FDA approved TMS in 2008 to treat depression that hasn't responded to medication and therapy.
We are stimulating directly underactive parts of the brain. Antidepressants do this indirectly by changing chemical balances.
But he says that doesn't work for about 50% of patients with depression, while TMS goes straight to the source.
In our treatment-resistant depression clinic, we're seeing 80 to 90% of patients have remission of their depression.
They are different people.
Mm-hmm.
The therapy targets a patient's brain with an alternating electromagnetic current to move electrons inside the skull that are constantly communicating. The same way an electromagnetic field can be used to spark a light bulb, it can also spark the underactive areas of a depressed brain.
There is lots of research being done all over the world in looking at using this technology to target everything from schizophrenia to obsessive compulsive disorder to ADHD.
Patients come in for 19-minute sessions Monday through Friday for 6 weeks.
Why is it only used for treatment-resistant depression? Why do you need to try the drugs first before this?
The landmark studies of kind of how people respond to medications, right, were published before TMS was approved. And so it kind of was shuffled in at the bottom of that.
He says it can take decades for newer and more expensive treatments to become accepted. But he says this treatment has the potential to help a lot of people in pain. Dr. Lewis says the TMS treatment has helped dozens of his patients, and he believes it will become standard treatment for multiple conditions over the next 10 years or so.
And really eye-opening, story there, and a lot of promise for people who are looking to get some relief. So, everyone wants to know, right? How much would treatment cost?
That's an issue with these. They can be really expensive. Dr. Lewis says even with insurance, a full TMS treatment can still cost about $1,000 out of pocket with copays. And at Parker's practice, the therapy typically isn't covered by insurance, she says, and a full treatment can cost about the same, about $1,000 over the full course. But she says she does offer payment plans.
Wow, it's a very interesting story. Thank you, Ann.